This video is brought to you as part of the Paired Health Mobile Medical Care Educational Series. In this video, Paired Health Medical Director Dr. Mike Watson and Physician Assistant Jana Regan will discuss their stance on dealing with pain management during the post-discharge transitional care period and how they've learned to pick up on certain cues to determine the motivation for frequent requests for opioids. Let's hear what they have to say regarding situations where pain management comes into play during the transitional care period or during the time following an ED visit, and how they assess these situations to decipher appropriate pain treatment versus abusive behavior.
You know, I think that's a common situation that comes up. Certain patients have more problems along the lines of addiction and narcotic pain medication, opioids. And our general policy is not to prescribe opioids for chronic pain. And part of that reason is that we are only seeing the patient for a brief period of time, really, 30 days, a little bit longer sometimes. You know, how to deal with a patient who's insistent or who seems not to take no for an answer. You know, I think you have to really assess the situation more than anything else. Some patients, you know, really do truly need pain medication, an acute injury. You know, they may well need medication for that. But medication, narcotic medication that's being used on a long-term basis, we really would not get into that situation of supplying medications for that patient. Sometimes you can get a good feel for whether a patient is abusing an opioid or not. You know, if the history is a little suspect, they've lost medication, they've misplaced medication, they've been taking more than was prescribed by the previous referring physician. All these are clues that it might be more of an abuse situation than it is actual need by the patient.
Would you point to any typical behavior traits that seem to be associated with a patient who may be seeking narcotics or opioids as opposed to a patient who is genuinely looking for pain relief?
Yeah, well, you can get a sense of that. You know, I think the more insistent, possibly patients who are narcotic seekers become more hostile easily. But you have to be careful, because if a patient is truly in pain, they can be fairly insistent too. So you really have to be careful about how you categorize the patients when you're assessing them.
Get asked a lot about is patients are asking for refills on their narcotic medication, and so our policy is basically we don't want to treat chronic pain with narcotics or opioids, but there are some situations where maybe a hospitalist initiated an opioid therapy for an acute reason, and we might do one refill on that. But the main thing we want to do is get someone in with their primary care provider or in with a pain management clinic if that is something that is needed.
Thanks again for watching this segment of the Paired Health Mobile Medical Care Educational Series. Please don't forget to check out some of our other modules on home visit program best practices located in the Learning Center on our website. These are all ranging from more common visit scenarios encountered to ways to streamline your home visit program process and procedures to make it more efficient, effective, and consistent. Thank you for watching this segment of the Paired Health Mobile Medical Care Series. Remember to check out the rest of our series and much more at www.pairedhealth.com.